Hi, my name's Diane Dunniway. I'm a women's health nurse practitioner, and I absolutely love Dutch for how it helps me to see the whole picture and interplay between hormones and adrenals, and then I can look at that and associate that with their thyroid as well, because they all affect one another. And Dutch has really helped me to counsel better my women that are on hormones, because it's not the hormone per se that causes problems like breast cancer, but it's what the body does with hormones. And no test before Dutch ever told me that. The metabolism through the liver, the methylation of their estrogen. So those are the things I love about Dutch.
What inspired you to become a healthcare practitioner?
Well, I had been a nurse for a number of years in various roles in the hospital, in the community, and I knew that I loved teaching. I loved teaching patients. I wanted to teach nurses, and I knew I needed to go on then in my education. So I wasn't sure if I wanted community health nursing, acute care nursing. I loved all parts of nursing that I had done. And then we had the loss of a full-term baby boy. He had a hypoplastic heart and only lived 4 days. And it was the outpouring of support that we had, not only from our church community and our family, but the staff at that hospital, that made me want to give back. And so I took a position in labor and delivery, and I worked with the grief support committee, and I would volunteer for those couples that came in with a known loss. But labor and delivery, for the most part, is a happy place. And I love teaching women about their bodies. I knew that I did not do well without sleep, so midwifery was out. So that is why I chose women's health nurse practitioner degree.
Tell us more about what your training is.
Well, I started with the diploma of nursing. It was a 3-year for more skills part, and then I went back for my bachelor's in science and nursing to Illinois Wesleyan University in Bloomington, Illinois. And then we got a family going. And when I did go back, I went to University of Illinois at Chicago for the Master's of Science in Nursing with the focus in women's health nurse practitioner. Graduated from that and got certified by the National Certifying Corporation and started in a very busy OB-GYN practice. And then a few years later, I did my dream of teaching actually nurse practitioners for UIC. I was taught classes, plus I was in charge of their clinicals, anyone outside of the Chicago area, downstate Illinois and around. I made sure of where they got into clinicals and oversaw that. And it was during that time that I had the opportunity then to be one of the first classes for the doctorate of nursing practice for UIC. And when you go on for the doctorate, you focus even further in your specialty. And so I decided to focus on hormones. Number one, because when I originally graduated with my nurse practitioner degree, it was in 2002. That was the same year that the Women's Health Initiative research on hormones hit the fan. Everything we thought we knew about hormones was turned upside down. And I saw women going off hormones right and left and just being miserable. And then just a few years later, I personally became menopausal at the age of 45. So I not only had a clinical reason to study hormones, but I had a personal reason. So that was what I did for my focus was for menopause, was on hormones, but I wanted something better for my cycling patients as well, because birth control is just given out for the answer to everything in women's health, from irregular cycles to painful periods to even acne. And I saw the multitude of side effects with birth control, and I knew there had to be something better. So during my doctorate of nursing practice, my other focus was something that I found called Creighton Model Fertility Care. And with Creighton Model, it made me drastically change my practice. I no longer prescribe birth control, but I feel like I'm helping women so much more because we work with the body instead of against it. In fact, the new women's science that's resulted is called NAPRO technology, natural procreative technology. So I work with women to balance their hormones. Our effectiveness studies to avoid pregnancy equal, if not better than the birth control. And I do a lot of infertility to balance things. So all of that hormonal with menopause and my cycling women and looking at root cause was just a natural next step to functional medicine, which I absolutely love. So I went on to the Functional Medicine University and got certified in functional medicine. I'm often asked, okay, you did 11 years total of education prior to even the functional medicine degree. Why didn't you just become a doctor? And I mean, it's a fair question. It's a lot of years, but I love the nursing model. It's always been wellness focused. It's looking at the whole person, and it empowers the patient. And that's what functional medicine does as well.
Where's your farthest patient? And kind of tell me a little bit about your practice.
Well, my practice right now, because I just started this in October, is mainly the patients that I saw in my last OB-GYN practice who have followed me and can see me virtually through telemedicine. But we changed our domicile state to Florida, so now I also have a license in Florida, and I'm just starting to get patients from Florida in my practice as well. And I do still focus on all of the hormones and thyroid and adrenals, and of course gut health, very important for all of my patients. So it's been a fun ride to be able to still see patients no matter where they're at. I may add other states, but I wanted to make sure I had room for my current patients first.
Do you do any other functional testing in your practice?
I do. I don't do as much saliva testing since I now do Dutch testing, and I do the Dutch complete mainly, but if it was only adrenals that were off, I'll do just adrenals if I repeat it. But I also do some food sensitivity testing. I do stool testing to look at the whole biome. Since doing Dutch and noticing that a lot of women have problems with methylating their estrogen, I also started doing a methylation blood test and cheek swab, so I see the methylation genetic SNPs as well as how they fit into the methylation cycle. That's been very eye-opening as well.
What are the changes you have seen in your patients and/or practice since you started incorporating the Dutch test?
Well, the changes that I've seen in my practice include being able to counsel women better in their risks and benefits for staying on hormones or going on hormones. What I've learned in functional medicine is it's not the hormone itself that can cause problems like breast cancer, but it is what the body does with hormones. And so now I can see that metabolism, I can see that methylation, and it helps us to know if it's safe to keep them on. It's been rare that I've had to take them off because the supplements and things that we work on with gut health and liver health usually do help significantly, but it makes me feel better keeping them on if that's what theirs is, if I know that their body knows how to handle the hormones. The other huge change compared to the saliva testing that I did was with the adrenals, because the Dutch test not only gives me the pattern in 24 hours, and it gives me the 24-hour cortisol, but it also gives me the metabolized cortisol. So for example, they might look flatlined, where I would be thinking, oh, I got to throw my whole adrenal insufficiency protocol at them with several supplements. But then I look at their metabolized cortisol and it's actually high, which means they're making plenty, but they're over metabolizing it. So that's a simple answer at times as well. Or maybe they look like they're high, but they aren't making, the metabolized cortisol is actually midline or below. So those patients don't need their cortisol brought down, they need their adrenals supported because they're not clearing their cortisol and they actually would not tolerate bovine adrenal hormone. So overall, it's helped me treat patients more effectively, so I feel like our outcomes are much better.
Do you utilize Dutch as a baseline, and do you do any sort of follow-up testing?
Both baseline and follow-up, actually. I will use it to help my patients preconceptually, or those who are trying to achieve and having problems, so that we can hit as many different possible causes. and I will use it in perimenopause to help in the drastic changes that they are going through, and also to give me an idea if they will tolerate hormones if it comes to that as they get closer to menopause. And I use Dutch a lot in menopause because I want to know, like I said, that their body is handling the hormones well. And especially if I've worked with their hormones and made drastic changes or worked with their adrenals, we want to retest, and the patient usually wants to too, to make sure things have improved.
I know that you are practicing more virtually, so are you taking on more patients or more clients?
Well, I actually semi-retired. I work 2 days a week, but so far I've had plenty of openings for patients. And due to COVID shelter in place last year, I hadn't seen my grandkids for several months because they lived in Florida. And that's why my husband and I moved up our plans to full-time RV and a motorhome. So we sold our house, moved into a motorhome. We made up time with our grandkids this summer, but now I'm with a telemedicine company called My Catholic Doctor, PLLC. They've made it so easy because they're credentialing me with insurances, they bill for me, they're very supportive, and we have all kinds of practitioners on My Catholic Doctor, from family practice to integrative medicine, functional medicine, naturopaths, physical therapists, psych, pediatricians. We have everything on there. You just click what state you live in and you'll see who's certified in your state. And so that's made it easy. And then I Zoom with my patients, which is very patient friendly. Even for my very senior patients, it's worked out very nicely. And it's kind of nice because if I ask them their med list and they can't remember something, they just go in the next room and get it and can show me and read exactly what they're on. And that's been a good advantage. And companies like Dutch will drop ship the test kits directly to my patient. And that has been very nice to have with the type of practice I'm in. I can't collect kits and keep them and mail them constantly to patients since they don't come into an office per se.
How do you see functional and integrative medicine 20 years from now?
I hope to see integrative and functional medicine more mainstream medicine. I would like to see it taught more in the medical schools and nursing schools, and more nutrition is needed there. And hopefully the research will continue to grow. It just seems to be growing in leaps and bounds and will be more accepted in mainstream society. I think patients are demanding it, and that will happen. We just have to bide our time.
And since you've become partially retired, what do you like to do outside of work?
Well, after we made up time with our grandkids in Florida this winter, we're on the move in the motorhome again. Right now, we're back in Illinois visiting. We came for Mother's Day to visit my mom and his mom and our families, but then we're gonna go out west and go to Wyoming and Idaho, and I have a son out in Oregon, so we're gonna go to that coast. So we love finding hiking places and biking places and kayaking and just exploring this beautiful country. And I feel very blessed that I can do that and still do what I'm passionate about in treating my women's health patients.